All right, I'm gonna review my physician's order. I'm gonna perform hand hygiene. Hello, Hello, my name is Elizabeth. I'll be your student nurse today. Could you please verify your name and your date of birth for me, please? Ms. Jones, I will check it against my patient's wristband. It matches. All right, Ms. Jones, I'm gonna provide privacy first. Ms. Jones, this morning I will be inserting your Foley catheter, and what that means is you'll have a tube that goes inside of your bladder, and your urine will drain into a bag that will be hanging on your bed frame. You understand? My patient verbalizes she understands. All right. I'm gonna prepare my sterile field. Before I do, I'm gonna let my bed up to a working position. Let my side rail down. I'm gonna go ahead and have my patient to get into the dorsal recumbent position. Okay, I will check my patient for paracare. My patient needs no paracare at this time. Okay. I'm gonna use this as my trash can. I'm gonna open my sterile gloves. Okay. I will not be using this, so I would discard it. Gonna disregard. All right, Ms. Jones, are you allergic to anything? My patient has no known allergies. Are you allergic to iodine? She's not allergic to iodine, so I'm gonna place my tray to the side. I would open up my, my patient's not allergic to iodine, so I would just discard my peroxide. I'm gonna open my iodine and I would place it over my cotton balls. I would discard my empty package. I'm gonna open up my lubricating jelly and I would place some on my tray, discard my empty pack. Next, I will go ahead and get out my Foley. I would make sure that it is a 14 French Foley. It takes 5 to 10 mils, so I will make sure I have 10 mil of sterile water in my syringe. I'm going to go ahead and take off the package to my tube. I'm going to discard it. I would check my syringe for any bubbles. I don't want to insert any bubbles inside of my patient. I will make sure I have 10 mil. I do. So I'm going to go ahead and place my syringe on my Foley. I'm going to discard. Okay, I'm gonna take my tube and I will go ahead and, well, no. First, I'm gonna clean my patient's labia. And I will use my non-dominant hand to hold so that I'm able to clean. I would start from the outside, go straight down the middle, discard, outside, discard, discard, discard. I'm going to continue holding. I will take my tube, place it in my lube to lubricate it before inserting into my patient. I will let my patient know before inserting, Ms. Jones, could I get you to take a deep breath? As my patient is taking deep breath, I will insert my tube, making sure not to touch my patient's labia or outside of her vagina in any way. I will insert 2 to 3 inches, and when I see clear yellow urine coming out, then I know I'm in the right place. So I will go ahead and insert 1 to 2 more inches. I've made sure that I have 10 mils of sterile water, and I'm going to use this to inflate. I'm going to use this to inflate it to make sure that, inflate the bulb to make sure that it stays. Alright, I can discard my syringe. I'm going to check to make sure that it's secured. It is secured. Alright, I can dispose of my sterile gloves now. Oh, I took that off wrong. Alright, I'm gonna put on clean gloves to tape my patient's tube to her inner right thigh. I'm gonna make sure to leave a little slack . Okay, I'm gonna place my bag on the bed frame of the bed, making sure to keep it below the bladder. Okay, I'm gonna discard my supplies. Okay, I'm gonna make sure my patient is comfortable. I'm gonna let my bed back down to its lowest position. Make sure the side rails are up ×2. I'm gonna place my call bell within reach. Place the patient's call bell within reach. I've instructed the patient to use the call bell if there is any bleeding, there's any pain. I've also instructed my patient to not pull her tube. I've educated my patient on making sure that the bag stays below the bladder. My patient verbalizes understanding. She's also used to call Bev if any other assistance is needed. And that's it.